From the living room to the Senate floor, from first responders to technology innovators. Different roles, different stories, but one goal: to meet the need for crisis care and overcome the obstacles together. So join in. The Crisis Jam is starting now.
Welcome, everyone, to Crisis Jam, episode 233, as we near the end of season 5. My name is David Covington, and I'm your host today. And we're thrilled to have the leader of mental health and substance use for HHS and SAMHSA with our Principal Deputy Assistant Secretary, Dr. Art, who's joining us today. And my dear friend and an amazing leader in the field, Tonja Myles, will be moderating a fireside chat with Dr. Art here in just a few minutes. So we're looking forward to that. As always, talk.crisisnow.com is your go-to resource for getting registered for the newsletter and for past material. Ted Letterman last week was incredible. There was a study that came out last year saying not much capacity had been built since the beginning of 988. And a lot of us said, yeah, that just doesn't, we're not sure about the data they're using. And Ted's team at the National Research Institute has done enormous amount of surveying of the states and brought an incredible story this past week of the development of mobile crisis teams and crisis facility capacity, and that vision of HHS and SAMHSA for building out someone to call, someone to respond, and a safe place for help as well as follow-up. We're seeing that come alive. So really a terrific episode last week with Ted, and you can see that there on the Crisis Talk website. We are going to be unveiling, if Gerald wants a cliffhanger, we will be unveiling a brand new, much easier to remember URL for Crisis Jam coming up with the start of the new season here in 2 weeks. And as always, our YouTube channel, 5 Lanes to Recovery, has all of this material and more in addition to what's on the Crisis Talk website. We've been really going back through the vault and compiling this amazing history since Dr. Richard McKeon first brought a group of us together back in April of 2020. And now we're about to start into season 6. We've had 30,000 change makers involved, we believe. And you can see we have typically been talking about the number of unduplicated speakers who have actually presented in Crisis Jam, nearing 600. But we're also looking in this coming season to focus more on bringing new countries to the mix. We've had a host of different kinds of features, from the routine segments to things like our debates, our days in the life. Today we've got a fireside chat and special event. And you can see our top 5 episodes. We'll start tracking that here in the new season. As we look at the crisis news that's in the first look at a Mental Health America report, the state of opioid overdose and response in the U.S. In 2017, declared the opioid crisis a public health emergency and led to an increased investment and implementation of interventions to decrease overdoses. At the same time, millions of dollars have been awarded to cities and states from increasing resource for overdose prevention, harm reduction, and response. And there's a lot of detail in this new Mental Health America report. Last year, there was another report from the CDC, a lot of material about the medication overdose, and you can see more about both providers, pharmacists, and payers. And then more recently of this year, JAMA Health Forum had a new research article on the estimates of illicit opioid use in the U.S., and the figures are just simply expected, with 11% of adults reporting using illicit opioids in the past year, and almost 8% reporting using illicit fentanyl. Most began with prescription opioids, prescribed or not illicit, and a number of are concerned about an overdose. So that brings us to our over-under, our hot seat. You may remember this question. Margie Balfour is on a mission to change the way communities respond to crisis. In 2022, she stated 15% of adults present with substance use disorder as a primary diagnosis when they come to an Arizona crisis receiving center. But she also talked about not only those individuals, but those who have a secondary or primary and or a positive toxicology. So when you add up those with a primary substance use diagnosis or a secondary or a positive toxicology, what percentage of those individuals who come into a crisis receiving center would be represented? So Brian Hepburn, in our green room, you gave a guess, which I thought was a good one. Do you want to share that with the Crisis Jam community of what you thought might be the overall percentage who would have either a substance use diagnosis or a positive toxicology? Let's see if Brian Hepburn can come off mute.
I said 40%.
Okay, 40%. Really good guess. So audience, jammers, what do you think? Jump into the chat and let us know. Do you think the overall number of individuals coming to a crisis receiving center with a Teresa Mills says 60%. So significantly over 40% from Heather Aston. I'm seeing only overs at this point, unless, except for Jerry, who says under, I hope. I think it is under. I see primary as mental health. So primary, again, 15% have a primary substance use disorder. So that would mean you're absolutely right, Mary, that the majority have a primary mental health. But when we look at either a primary substance use or a secondary substance use or a positive toxicology, that number is 65%. And the point that Margie was making is how vital it is that crisis facilities are prepared and equipped not only for mental health and suicidal crises, but for substance use. She, at that time, presented and talked about methamphetamine and alcohol account for 75% of the substance use diagnoses. And it just shows how important it is for crisis receiving centers to have capabilities like medically monitored detox, MAT initiation, and SUD counseling and peer support. And in season 6, we're going to be really raising our game around substance use presentations. We've got a Fireside Chat on October 29th with Dr. Rochelle Head Dunham, former Commissioner of Mental Health in Louisiana, in a presentation or Fireside Chat, What They Don't Teach in Addiction Psychiatry. And on December 10th, we'll have Dr. Deborah Haskins with Trauma-Informed Gambling Care. So one more trivia question. Let's go to our normal Who Wants to Be a Millionaire? And we're going to be bringing back the Who Wants to Win Crisis Jam swag. So starting with season 6 in 2 weeks, if you're in the hot seat, you will get to choose from the new Crisis Jam shop, which we've already got a number of items and new, we hope will be fun riffs on the 988 and crisis content that we've had previously. But for today's hot seat Crisis Jam swag question, Who Wants to Win? In 2022, Dr. Rahul Gupta, who was at that time the director of the Office of National Drug Control, described on CNN a progression of challenges in overdose death rates. What's the most recent stage in that progression? So he mentioned all 4 of these, but he said they've developed from one to the other, to the other, to the other. So what is the most recent? Is it prescription opioids? Is it heroin injection? Is it fentanyl cut with heroin? Or is it fentanyl with stimulants like methamphetamine? And the Crisis Jam audience, we've got about, looks like we've almost got the usual number jumping into that poll. Over 70% say it's D, fentanyl with stimulants like methamphetamine, and that is the answer. In 2023, the CDC reported opioids mixed with cocaine or psychostimulants were driving more overdose deaths. So vital to incorporate substance use into our mental health and suicide crisis work. It's always a part of the mix as we're dealing with supporting individuals. And it's perfect to bring us to our lead story for today, which is a fireside chat with our director for the federal government related to mental health and substance use. And Dr. Art will be joined and moderated with our Crisis Jam friend, Tonja Myles. So Tonja, thanks so much for leading this chat with Dr. Art. It was amazing being with the two of you in Baton Rouge and seeing you and your team at Set Free Indeed, Tonja, out on the front lines, and hearing both you and Dr. Art talk about your own recovery stories and your vision for supporting individuals at risk. So, Tonja, the miracle of recovery.
Yes, happy Wednesday, everybody. The miracle of recovery is possible. And I just want to say thank you to David, and thank you so much, Dr. Art, for joining us today. How are you?
Doing good. Really appreciate you having me on.
Look, it's always good to visit with you, and let's just get to it. I know I'm not going to read Dr. Art's bio. You can go to samhsa.gov to get that yourself. He has an impeccable bio, but mostly he's compassionate. I've been following his work for probably over 10 years now. I remember when I first came across his book, Planting Seeds, and it was a game changer. And now that book is in prisons where we're teaching people about peer support and recovery, and schools and other places. So thank you for your work that you've been doing all these years. So tell us about your role as new Principal Deputy Assistant Secretary at SAMHSA, Dr. Art.
Well, it's a real honor to be here, and I really appreciate you having me on. So I was under President Trump. This is my second time at SAMHSA. President Trump was, as your moderator said, David Covington said, I think he was preeminent in elevating the opioid addiction crisis that America has faced. So I started off at SAMHSA as a senior advisor, and then I ended up in the White House working on addiction and mental health policy. And then I served as the deputy director at ONDCP inside the White House. So this is my second time back. This time I came back as the op-div leader of SAMHSA, and we view what we want to do, carrying out the executive order of the president and working for Secretary Kennedy, who's been a great leader on this issue himself, and he knows it intimately well. So my job is to sort of follow along with their direction, implement policies that are really good for the country and for the people. So really what we want to do is we want America to heal. We understand that the family, it's not just a statistic when we say overdose deaths, right? As you know, there's a family that's suffering that was sort of left behind. So what we want to do is alleviate this crisis and help people understand the hope that comes with recovery.
Yes, the miracle of recovery. So how long have you worked in behavioral health?
Well, it depends on when you sort of want to start. I have a long drug and alcohol use history myself from New Orleans. So when I got sober a little over 23 years ago, I went up to Minnesota, pretty much aimless, didn't know what was going to sort of happen. And then from there, I started as a peer worker. And I was taking the new admits into the treatment center. I was living in a recovery house in an Oxford house, and I was doing volunteer work, service. One thing led to another. I went and completed graduate school before a doctorate, but I started working in the field almost immediately after I got clean and sober myself.
Okay, so that's pretty cool. First of all, yay for your years of recovery. Whoop,
Yeah.
whoop. So how you talked about your own lived experience. Do you believe that this has helped you in behavioral health in your profession now as head of SAMHSA?
I think it does. You know, I'm not one of these people that says you have to be in recovery to understand the disease, right? But I do think it's sort of helpful. And I mean, I know you know this too. it's very helpful to actually, I say the client, but to actually know who it is we're trying to treat, right? To sort of know that person sort of intimately, what they're going through, their feelings. So if you go like to group therapy, you go to an AA meeting or everything, but people sort of misunderstand sometimes is you're not really relating to the drug of choice. You're relating to the feelings that somebody has that are suffering with this sort of ailment, right? So I think you get to know how they feel, right? And so you're not just addressing the drug of choice, but core issues that actually facilitate addiction.
So I pulled up this really cool quote from back in the day, and it's a quote from you, and you said, in our view, or in your view, treatment is not the end point, but rather the beginning. We want all those affected by this experience, to experience the great awakening that they are capable of and deserving of living a love-filled life. You're really passionate about that.
Well, I am. I am. Thank you for noticing that. You're passionate about it too, and I loved your program, and I got an opportunity to visit it. But I'm not the only one in my family that's been afflicted by this disease as well. So, I sort of had it on both sides, me, other sort of family members, and then growing up in my New Orleans neighborhood, I lost people as well to sort of this disease. But I also had the opportunity as a treatment provider to see like the Great Awakening when the lights go off, right? So I refer to this as the miracle of recovery. Reason is like it's probably the only thing where you could take all your hardships, all these things you think you need to be ashamed of, all these things you sort of tried to bury and hide under alcohol, cocaine, or drugs. You could take all of those things and turn them into an asset. Those experiences could be used to impart wisdom, guidance, and modeling great behavior and assisting sort of the next guy. So you can take all those things, like what you went through, you can convert that into an asset and look at the program that you made, helping people that you've been able to do.
Thank you for that, Dr. Art. I really appreciate that coming from you. So what are some of the priorities of your office when it comes to addressing behavioral health in our country?
Well, we're prioritizing, with MAHA, we want to make America healthy again. So one of the priorities, and SAMHSA recently put out a pilot program to treat hepatitis C, which is actually, people with a substance use disorder are greatly afflicted by that. So we want to treat the chronic diseases that lead to more misery, more diseases, and we see behavioral health as one or poor behavioral health as something that actually creates a lot more sort of medical ailments, the breakup of families. So we want to sort of treat those underlying causes to make America, healthy, self-sufficient, and experience a life of joy. So that's really, when you look at Senator Kennedy's vision, is how do you treat those underlying causes and conditions?
So we know that we are in an opioid crisis. So what are some of the efforts that this administration is doing to address the fentanyl and opioid crisis?
Well, we put out a big media campaign that President Trump was behind to do that, and I think that's very sort of important. We're also addressing it on the demand side. We're looking at targeting hard-hit areas, and like one of the reasons why your program was so intriguing to me is because you actually go out there and you see the people suffering. So how do you intervene on somebody, get them into treatment, and then like close the back door with supportive living environment, recovery housing to get them on their feet back to self-sufficiency. So we want to, instead of just like always going to the like emergency room and back on the street or suffering, we want to actually work them through the system into self-sufficiency. So recently, SAMHSA, we just put out $43 million for recovery housing assistance, and we addressed that to one of the harder hit age groups. We also put, working to create assisted outpatient treatment. We put out a technical assistance supplement just the other day as well. So we're looking to increase AOT treatment to help severely mental ill people. And as we say, we're also looking to address, like I'm a big advocate of step down levels of care, and President Trump signed the executive order that's actually working to actually bring treatment to our most needy population.
But yeah, that's really good, because I think, we've done a great job of putting the emphasis on mental health, which is needed, but it's just so glad that now we're talking about, treatment and sobriety and that whole crisis continuum. So I just can't thank you enough for your passion for that, because, you know, that's near and dear to my heart. We know that SUD is a challenge for individuals who are experiencing homelessness, and that's very high. What are some of the roles that SAMHSA play in addressing this? We know that's something that we're talking about, you know, as linked in our community now, which is great. So what are some of the things that, you know, you guys are doing to address this?
Well, one of the things I want to thank you for just saying the word sobriety. So, thank you for saying that. So we're looking to sort of emphasize the word sobriety and recovery, right? So it's not okay to allow somebody to be self-destructive. I don't find that the humane aspect of it. I think if you can actually help somebody in suffering, you do. So it's not okay to allow somebody, especially like in a homeless sort of encampment, to sort of just suffer out there. So I think the more we can kind of address them, and that's why I was very impressed with your model of, you know, the peer recovery system, getting people out there who have been through it to address people like you've been doing. So with SAMHSA, what we're doing is we're looking to sort of overhaul a lot of our system to where it actually meets the needs of the people and doesn't meet the needs of the system. So that's really our big sort of turning point, is how do you actually reach that person that's suffering? That's really what this is our emphasis now. And just like with Secretary Kennedy, how do you get to these underlying causes of chronic diseases and how that creates more suffering?
So that, I think that's all the questions I have for right now, and I really appreciate your time. But Dr. Art, you know, you are a ray of hope, and we know that, you know, mental health and substance use disorder does not discriminate. I say it all the time, from the curbside to country club. And so, you know, there are some amazing people that's on this call right now, and so we wake up every day to push hope. Is there anything that, you know, since we're, you know, celebrating sobriety and recovery month, is there any closing words you would like to do just to encourage?
Yeah, I do say this too, right? So I think if you're doing something that you sort of can self-destructive, and if you kind of work through that, that needs to be celebrated. To make that effort, that jump, to take all this hardship and turn it into an asset, that person who's working through that needs to be celebrated. And that's really sort of what I really want to do. And, you know, there's a lot of, like, if you look at it, this whole thing, addiction recovery, is a character building exercise where people actually finding what they're capable of, and they can take all their intrinsic value that they're born with and apply that toward their future life. So I
Well,
really
go ahead. I'm sorry, Doc.
no, I just want to emphasize that, right? So we need to celebrate those who've made that tremendous transformation in their lives.
Boop, boop. Well, that's what September is all about, National Recovery Month. And so thank you so much, Doc. I know you're busy. I appreciate it. And thank you for all the amazing work that you do. And we look forward to all the great things that you're going to do. So
okay, we'll be in communication. So.
Yes, sir. So I'll turn it over to David.
Okay. All right. Well, thank you so much.
Thank you so much, Tonja. And thank you, Dr. Art, talking about your living in a recovery home, finding your first steps of sobriety and moving forward, finding supports, and then developing your own career in this work. That vulnerability and leadership we so appreciate. And Tonja, we so appreciate you. Tonja, can you come back on for a moment? Tonja, talk a little bit about, if you will, the visit to Baton Rouge that Dr. Art, he came down, met with police and judges, but also had a chance to talk through his own recovery story, and your team shared many of their stories as you went out to show how you're working with individuals on the front lines related to substance use and opioids in particular.
Well, first of all, I was just grateful that, you know, people tell us all the time, we're going to come and see what you guys is doing. But I was grateful that Dr. Art came. And one of the things I like when he said, he's like, look, I'm not coming to observe, I'm coming to serve. I'm like, oh, okay, you want to serve with us? And so he actually literally went on the street with us to address homelessness and also be a part of our POD program, our Peers on Point program. I'm sorry. That's when every time law enforcement get a call for possible POD, we are dispatched with them, a peer support specialist. That that time frame, we did not have any calls. And I told him that. I'm like, I'm glad you're here, but I hope we have no calls. That means nobody overdosed. But it was great to, to go out in the community and just push hope and resources to people. We do some harm reduction, but our goal is to get people into treatment so they can live their best life. And I can't thank you enough for David for coming down. But, he met with our, 14 member team of peer support specialists. And then he met with law enforcement. We have this model called PH3, Public Safety, Public Health, and Public Hope, where we combine law enforcement, judges, businesses, faith-based organizations, treatment providers, and people with lived experience to go out and address SUD. But the last thing I want to say, what was so cool, is that, David, I don't know if you remember this, when we were in and we were talking about stigma, which we have to address. And I'm telling you, when Dr. Art said this, he said, you know what, screw stigma. We do recover. We was all about that life. And so, yeah, we do recover. And so that's why I'm so grateful that you're celebrating and you're honoring people during this month of September, because people do recover. We do recover.
Tonja, talk just a little bit about what your team does. I remember the incident that was the most striking for me was when we were in the Quick Trip, where you were sharing supports with the manager there, and there were 3 individuals who were living behind the car wash portion. And one of them on that day, I guess she had been talking about going into treatment for a number of months, but decided at that moment to go with your team. Talk a little bit about what you do and how that works.
So, yeah, what we do is we go and meet people where they are. And so, again, it's about treatment. And so we offer people that hope. That's why, our slogan is when you're ready, because we know we have to get people when they're ready. And so because of the British Center, let me just tell you, Baton Rouge has some of the best drug overdose decreased death in the country. And we're proud of that. We're proud of that because we have peer support specialists, because we're boots on the ground 7 days a week from 6 a.m. to 12 o'clock midnight, meeting people where they are on calls. And so we're able to get people into treatment quickly. So when we engage someone who's struggling, we ask them, can we help you live your best life? LIFE, live in freedom every day. And if they say yes, then we're like, okay, well, we can take you to the British Center for Hope or other places, but that's our primary place we take people. And if someone says, no, I'm not ready, well, you know what, we respect that. Well, can we come back out tomorrow? Or can you call us the next day or whenever you're ready? And so that person, that was a follow-up that they said that I want to go in tomorrow. I want to get my affairs in order. And so we went back, because we do a lot of follow-up, and we got them into treatment, as we have done with many people.
Tonja, thank you so much. And Dr. Chuck Browning, I'm going to come back around to you. So if I could tee you up, there were questions. There's a lot of chat around this high prevalence of substance use in the midst of individuals seeking help for crisis. And one of our crisis jammers was talking about the challenge of, well, how do I even know if they're on substances? Shouldn't they be in an inpatient program first, where they can get clear of the substances and we can have a better view of the mental health challenge? Certainly understand that. And that's been the common approach, which has led to this over-reliance on a bed model, as opposed to having crisis capabilities that can respond in the moment. So, Dr. Chuck, I'm going to come back around to you here in a little bit. I saw you chatting, and we'll look to you to share some of those reflections with the broader community. But next, let's go to Dr. Richard McKeon, who's going to represent SAMHSA for our SAMHSA update. Dr. Richard McKeon, are you with us?
Sorry, I was muted.
No worries. Glad to have you.
Okay. So
Richard, are you still there? I think we're having just a little technical with Richard. Megan, we're going to jump to you and come back to Richard if he doesn't come on here.
Gotcha. I'm here.
Let's do that. Let's jump, and let me just tweak my slide deck here a little bit, because I had another slide for Richard that I'm going to move. and
Okay.
we'll come back. So let's go to the Nashville update.
All right. I'm Megan Haupt, Chief of Staff with the National Association of State Mental Health Program Directors, and I wanted to talk with you about the 2025 National Dialogues on Behavioral Health Conference. It's an annual conference. It's the oldest behavioral health conference in the country. It's existed since 1959 in different formats. And this year, first of all, the great thing about the National Dialogues is it's a unique conference. They call it like a gem of a conference because there's a theme throughout the conference. And there are presenters and then in-depth dialogue, like half hour, even 45 minutes, even longer sometimes, to really go into the depth of a topic. And it's not just question and answer, it's really talking about the issue. And so this year, the theme is behavioral health in a changing environment, adapting and thriving. And what I loved about what Dr. Art said, he said a life of joy. And that's what this is really the crux of. It's taking place in New Orleans. No, that was a coincidence, but it is taking place in New Orleans, October 26th through the 29th. And that's a Sunday through a Wednesday. The Sunday is a pre-conference and talks about disaster behavioral health response and planning. It's about a half day there. Some great presenters. And then throughout the conference itself, we talk about funding and we talk about the continuum of care and best practices and workforce development and where we are going in the future with all these pieces. So we hope that you can attend, and I'll put the website in the chat box. Thank you.
Megan, that National Dialogues Conference was, I think, our first major interaction with NASBID as you were launching Beyond Beds back in 2017.
Yeah.
Brian asked us to do a presentation on the business model behind Crisis Now. We had published that with Richard McKeon and John Draper, the National Action Alliance, Dr. Michael Hogan, back in 2016. Really building upon the work that had been done in Arizona, Georgia, Colorado, and other states. And then Dr. Deb Pinels comes in and sort of the rest is history. But that conference, at least in that occasion, certainly was germinating a whole set of movements that strikes me a little bit about like global leadership exchange. And so this has been a key. How long have you been involved with the Dialogues Conference, Megan?
I personally have been involved probably about 5 years, 4 or 5 years. But NASBID is one of the partners, as well as WICHE and the NACBID, which is the County Behavioral Health Directors. And so it's just a great partnership. And Dr. Hepburn, our executive director of NASBID, and I serve on the executive committee. And there's a lot of planning that goes behind it, a lot of thought about what is the most cutting edge topic right now, where are people and where are we going? And so there's a lot of thought about that when creating a conference like this.
Terrific, Megan. And look, I'm going to go back to Richard. We've got we're trying some new technical things as we move into season 6, and we're starting to do a rolling start. So we're pulling in many of these new pieces, and Richard is now with us as on audio and video. But Megan, I want to come back to you because we normally would be doing our roundtable live section right now, but we're going to spend some of that time to go back on this journey a little bit as we launch towards season 6. But Richard, first, let's go to you with our SAMHSA update. I would do our new cool visual again, Richard.
Okay, sorry that I cut out. So let's try this again.
Yeah.
So first off, we are grateful to Dr. Kleinschmidt for his participating in the Crisis Jam today. It was wonderful and inspirational to hear his personal story, today. So we are very grateful for that and for his leadership. The couple of things to highlight for next week, of course. One is 988 Day on September 8th. The tagline I'm particularly fond of, which is compassionate help anytime, anywhere. And David, you framed many years ago the idea that a crisis, you can't make an appointment for a crisis. Crisis doesn't happen on a schedule. So you have to be available anytime, anywhere. But do you get help that feels like help? And so I love the tagline, compassionate help, because that's what we want, to be able to provide compassionate help, whether it's on the phone, on a chat, on a text, on a mobile crisis visit, or in a crisis stabilization unit. That compassionate help can be provided. Also next week, next Wednesday, is World Suicide Prevention Day. So the Suicide Prevention Branch at SAMHSA has put materials online at the SAMHSA website for different ways that people can participate on World Suicide Prevention Day. The theme for this year, as articulated in a message from International Association Suicide Prevention President Joe Robinson, is changing the narrative on suicide prevention. So two real major events coming up next week that we call your attention to, and really for the entire month of September, doing what we can to promote effective, compassionate suicide prevention anytime, anywhere. Thanks.
Love that, Richard. If you would stay on a moment, it was episode 100 of the Crisis Jam when we had Dr. Don Berwick on. He had written a journal article, something about a fanatic for patient-centered care, and had been one of our leading physicians in the United States, led Medicare and Medicaid for a moment, had led the Crossing the Quality Chasm efforts of the Institute for Healthcare Improvement, which in many ways laid the foundation, grandfather of zero suicide, Richard. But his life changed when he became a patient, or his wife in particular became a patient, and he was on the other side of that equation. So it's been such a great journey. But Richard, I thought we would go back to that, how it all began, as we talk about launching season 6 in 2 weeks. We look back, actually, the first crisis convening was on April the 8th. We met, you called together a group of us in the height of COVID to talk about the challenges of supply, demand, staffing, personal protective equipment, all of those types of issues that we were struggling with. We got together on that April 8th and then just met every Wednesday all summer. I've got some of the names, Richard, that I remember. Brian Hepburn, of course, Paul Galdis, Dr. Chuck Browning, Sue Ann O'Brien, Becky Stoll, Travis Atkinson, Dr. Bart Andrews. I know it got up to around 20 or 30, so I'm not remembering everyone who was. Any other names immediately come to your mind, Richard, who were in those early meetings?
Yeah, I think that that Dr. Mike Hogan was on at least some of those. I would have to give some more thought. I might see if I have on my calendar, if it goes back that far, if I can access it. But you're exactly right, David, and that was an effort that I've been authorized to undertake by Dr. Anita Everett, because we wanted to make sure, with so many changes, so many things going into lockdown in response to COVID, that we wanted to be able to get information about how the nation's crisis systems were functioning, including the call centers, obviously, who are answering calls, the National Suicide Prevention Lifeline, but also mobile crisis teams, because face-to-face visits by mobile crisis teams were being curtailed to a significant degree
That's right.
at that time, and how crisis stabilization units were faring. Because while some remained open, they had to dramatically reduce their census to achieve social distancing.
Yeah.
So we were very concerned about what the impact of all of this was going to be. So we were grateful that that numerous people in the crisis field were willing to talk with us and share what their experiences were, so that SAMHSA could do what we could to support everyone during that difficult period of time.
Yeah. And then, Richard, we've got some of the other formative events. So we already talked about the Beyond Beds and the Crisis Now. We had the Crisis Now 3 summit in DC in 19, just before that, where 64 of those leaders came together. And some of that content went straight into the national guidelines in 2020. But that meeting, which you called coincidentally on a Wednesday at 12 noon Eastern time, and we never varied from that time. We began to pivot away from COVID as our primary focus. And on September 17th of 2020, we had the first formal episode of the Crisis Jam when we put an agenda into place and began to have a routine sort of featured presentation, et cetera. But Richard, that shift to pivoting to 988 and the report you were writing with SAMHSA for the FCC and for Congress. And then I think the other key development for me was not just that group of us in the crisis field, but Brian Hepburn and Megan and Brian Sims began to bring in the states. And so this Crisis Jam community began to be a much broader set of stakeholders. What's your reflection on that fall when we began to make that shift?
Well, I think that was a hugely important time. As you said, that initially the focus was on the response to COVID. What impact was that having on the crisis systems? But we already knew at that point in time in 2020 that 988 was on its way. I believe it was in the summer of 2020 that Chairman Pai at the Federal Communications Commission had issued the FCC ruling that that by July 2022, every landline, every cell phone, every voice over internet device had to make 988 operational. Of course, in October, President Trump signed the Designation Act.
Right.
So we were in the midst of that transformation, and the Crisis Jam really became a hugely important vehicle for capturing the opinions, the voices, the evidence, the data that could support the efforts toward this kind of transformative change in the crisis system, the kind of change that we had written about in our report to the FCC about part of the reasons why we thought a 3-digit number could be an important catalyst in much the same way that 911 became a catalyst nationally for emergency medical services.
Yeah, terrific, Richard. And Richard, we have our AI depiction of Dr. Richard McKeon in the lower left has a crown on it. Was Monica Johnson the first one to coin King Richard? Is that where that came from, Richard?
That did come from her. I was never quite comfortable with it. But I have a colleague, Ryan, in the Defense Suicide Prevention Office, who calls me Sir Richard. I kind of like that a little bit more. So it's like, that just puts me like on a par with Sir Paul McCartney and Sir Ringo Starr. It's not quite as elevated.
Exactly. Okay, well, Richard, thank you so much. And look, a lot of more work to do, which is, and we'll be leaning into this in season 6 coming up, some of those videos from that early time. Megan, I'm going to bring you in because season 2, we've talked about season 1 in the pre-show, Dr. John Franklin Sierra, system engineering, and pre-show is now Backstage Pass. If you show up early, we've got some great stuff starting around 10 minutes till. But we did season 1 during the Backstage Pass. We've talked about how it all began. Season 2, we had this. This is the last time we had an assistant secretary present in the Crisis Jam was when Miriam Delphin-Rittman launched. She hit the champagne bottle, and we were off to the races to try to do the work of 988. But Megan, what are your reflections on 2022 when we went live and you started as a host that spring or summer?
You might be surprised by my answer, David. But this is something that I only know the Crisis Jam really does, and that's emphasize deaf mental health services for 988 and having video phone services. And that was, I believe, one of the first times I hosted was having presenters. It may have been Steve Hammerdinger, who was the former director of the Alabama Department of Mental Health Services for Deaf Services. He was the director of the Office of Deaf Services for the Department of Mental Health there. And Steve is, he's retired now, but he continues to be an incredible leader, mentor. And I think he just really led and mentored so many of us towards bring in the deaf community early when you're implementing something that is so wide scale or even not wide scale, locally. Don't create it for hearing people and then expect that it's going to, be able to be shifted for people who are deaf, who have very specific communication needs, culture, for example. And so I just, deep in my heart, love that this Crisis Jam has ASL interpreters, that periodically we highlight deaf mental health services and the 988 video phone services and how it's progressed. The deaf community, this has just been huge. That's what they report to me. Huge, huge, huge for the community to have that kind of communication, that direct service, not having to go through a third party who may not understand crisis. So I just want to thank the Crisis Jam for those opportunities.
Well, and your leadership, Megan, and NASHBIT and SAMHSA provided the funding and resources to make those things happen. So thank you. Of course, we started trivia questions back in 22. We started the Crisis Jam shop and began to have the old school 988 shirt that we had. Began to have quotes, and of course, Miriam Delphin-Rittman, who was the presenter when we went live. So, Megan, thank you so much. And before we get to Capitol Watch, I do want to bring Dr. Chuck Browning in. So, Dr. Chuck, there was some discussion in the chat. Thank you, Sir Richard, and thank you, Madam Megan. We appreciate both of you very, very much and your leadership and support and friendship. Dr. Chuck, a couple of reflections on the and I don't know if Margie Balfour is in today. We'd also welcome her to make a comment. But Dr. Chuck, your reflections on some of this conversation in the chat about substance use and crisis care.
Well, if you haven't seen the chat, the particular question was a question about delineating diagnoses when you have folks who are presenting. And now we're talking about the majority of folks in a crisis center using Margie's quote. And I thought that was one of the reasons my memory serves from years ago when she did that to bring that topic up. And I think it really pairs well with what Dr. Art has been discussing and sharing about the goal of bringing together holistic, whole person care in crisis spectrum, especially for both substance use and mental health, because it's more the norm that you're going to see both instead of the exception. So siloing off by making someone wait to get one thing taken care of before they can address the other is not considered best practice. And that includes diagnosis, recovery work, treatment work. You want to treat the whole person and think about those. The second question that got brought up, that was another really good question, is what happens when you see people with 3 and 4 diagnoses. And so the thing about diagnosing in crisis is there's some specific things where you try to stay general and look at all the possibilities, because you just get to see the person in a very quick snapshot. And so you want to be able to give that person education, support,
ideas about what you think the possible things are that could be going on and the possible things that you could do to start working together with them with both medicalized medication treatments as well as other recovery techniques, and then letting them partner with you to help decide what makes sense for them in that moment. But then you want to work in a recovery path that helps address both of those things moving forward. And that one thing we haven't talked about that is really important that you see a lot is folks present sometimes primarily in crisis with substance use and definitely have underlying mental health things that may have never been addressed in their life because of the system shifting them that way due to some of the silos. So it goes both ways, actually, David. Great topic, and I'm excited that the new SAMHSA guidelines started that push towards thinking about the whole person, because if we're going to have the best system of care, it's going to address both things.
Yeah, great stuff. And Dr. Chuck, we'll look forward to your fireside chat with Dr. Rochelle Head Dunham, one of the nation's leaders in this work, coming up in just a couple of months.
Great, thanks.
Look, I appreciate your patience with us today. We're working out the some of the technical pieces as we jump into some new components for season 6. Capitol Watch will be actually back next week as we have our legislative review. We're following the states. All of that will be coming as we move into the formalizing our new framework. We're letting some segments go, bringing in some fresh ones, trying to revamp the whole approach to make it tighter and more engaging for all of you. But I want to bring back Tonja Myles. Tonja, you want to talk a little bit about this event that you're leading, that the administration asked you to initiate for Recovery Month?
So we know that, there's places of faith, different all over the country, but we also know that faith without works is dead. Look, I know when I was in the throes of my addiction, not only, there were days where I was praying, help me get out of this, but I know it was my family members, because we know addiction affects the entire family. So, we're just coming together and we're just having a time of reflection and prayer to celebrate those in recovery, but then also pray for those who's lost loved ones to drug overdose, to those families who are still struggling. We are going to be having Ben Odell, who's the acting director of the Faith Center inside of HHS, Raul Andrews with American Psychiatric Association Foundation, Dr. Zach Clinton, who is a part of the American Association of Christian Counselors. They're 50 members strong. And of course, Sean Langston, who's part of RI. But they're going to be national leaders coming from all across the country to just pray for this crisis, pray for people who are, still struggling. Because at the end of the day, we know that there's a lot of prayer and thoughts and that's needed like never before. So please jump on. It's Sunday evening. It's just going to be a great time of just all faiths coming together, one mind, one mission, and that's to just pray for this crisis that we're all going through.
So Tonja, if somebody wants more information on that, they should just email you at setfreeindeedministry.com.
Yes, that's correct. And then we're going to be pushing out. Matter of fact, we're going to be going live with everything in about an hour or so. And there's going to be a link. All you do is sign up and jump on. It is going to be pretty incredible. And we brought together a whole diverse, crowd of people. So it's going to be pretty cool.
Great. Thank you so much, Tonja. And now Stephanie Hepburn. Stephanie, I'd love to hear a quick reflection on you. 300 plus Crisis Talk interview articles that have been read all over the world over the last, and you predate the emergence of Crisis Jam. You actually started a full year or more earlier than the Crisis Jam with Crisis Talk. But you're shifting to a podcast for season 6. And would love to hear anything you'd like to share with the community about what you're hoping to achieve in this next iteration of your work.
Thanks, David. Yeah, I'm really excited about this transition. I launched Crisis Talk in May 2019, so that's 6 years of articles and 6 years of interviews. But there's some stories that just require deeper investigation, deeper discussion, and frankly, a broader audience. I want to maintain the Crisis Talk audience, give them what they need, but I also would like to produce a podcast that also brings other intersections and individuals so that people understand that this is a public health issue that affects all of us. I think what I'll start off with is doing back-to-back series, as opposed to, David, in the beginning, the idea was that Crisis Talk would be like a book. You would have one conversation, one perspective, one lens. you turn the page and it would be perhaps the same topic, but a different perspective. That was a lot harder to do with categories and classifications and timing, right? It didn't always work out. And so I hope to kind of take this to that next level where I am doing a deep dive. We are having that dialogue, maybe 3 to 5 episodes per series, and make it more layered, a more layered conversation, more layered dialogue. So I'm still in the process of developing this. So if people have feedback, reflections, I'll put my email also in the chat, but I'm very excited. I don't know, this is like all new. So
terrific.
Well, you have some thoughts, I'd love to hear those too.
We're thrilled to see these next steps, Stephanie, and we'll look forward to the rollout in coming weeks. Stephanie and Karen as well, if you guys can share your contact information in the chat. We've got a number of questions about content people would like to see more of.
Yeah.
And we can also maybe share some of the either Crisis Talk and or YouTubes of prior Crisis Jams where we've addressed some of these supports that people are recommending. But let's take note of all of that. Look forward to more on that. Just a quick note, we've talked about the Lab of the Possible. Crisis Now 4 is going to be next July 28th and 29th. Now, the last one, Crisis Now 3 in Amsterdam, we actually oversold, sold out. First time we burst out of our space that Deloitte had for us in Amsterdam. And we'll be in the same facility that NASBID is hosting the summer annual meeting of mental health commissioners. We'll be in the days immediately following. Megan, Brian, and Brian will be there on July 26th and 27th leading the NASBID, and then we'll all come together for Crisis Now 4. These have been invite-only kind of events before. We're going to be growing the capacity this year, so more to come on that. We'll have a website and more information as we get into it. But these have been really great events to bring leaders together from around the world. We started doing these global summits back in 2014. Richard and many of us were working on zero suicide in healthcare. Dr. Mike Hogan, Dr. Jerry Reed, and others began those events. And we partnered with the Global Leadership Exchange, which Steve will be our speaker next week, leveraging their, at that point, every 18-month events. We were in Atlanta and Sydney. We had our first Crisis Now Summit in London in 2018. And Crisis Now 4 will be our 9th event. Over those 9 events, we've engaged over 500 of you from 29 countries. So one of our goals in Crisis Jam Season 6 is to begin to engage this broader international community, which we've not had as much a part of this work as we would love. Again, some of the top products, the international declarations that we crafted both with Zero Suicide and with Crisis Now. Participants from across the spectrum and a number of key corporate partners as well who helped make these events possible. So more on that. We have been thrilled the last 3 years. So this is season 5 we're ending. Seasons 1 and 2 were a grassroots kind of organic sort of effort that began to grow and spread. And with NASBID's leadership, suddenly we had all 50 states offices of mental health and or substance use involved in some way, numbers of state leaders and 60 national organizations. As this movement began to go forward, and the 988 electrified the field with its launch in July of 2022. So we've had SAMHSA funding to support the Crisis Jam through NASBID the last 3 years. And with changes in the way things are supported, that is ending as of this new federal fiscal year. So season 6 starting in 2 weeks. We won't have that SAMHSA contract that we've had previously, but we now have new sponsoring partners who've stepped in, and a couple of, we hope, rock star sponsors who are going to keep the Crisis Jam stage lit every week. We hope to unveil them over the course of the coming 2 weeks. But we're also looking for additional opening acts, people who would be our season 6 partners. And so we're still growing that out. So more to come on all of that, but that'll be again in the coming weeks. Steve, in 2 weeks, in next week in Global Leadership Exchange, Crisis Around the World, and in 2 weeks, the launch of season 6 with the Battle of the Bills. Senator Tina Orwell and Rep. Steve Ellison. It's going to be a barn burner, and we hope you'll join us with your local legislative leader around mental health and/or crisis care. So thanks for watching. Tune in, log on, and join the movement, and hope to see you next time.